I'm going to go ahead and start releasing the fasteners. So whenever you're removing the incontinent brief, roll it in onto itself and push it down, similar to what you do for a baby. And now if I haven't had the patient check the water temperature before, I'd have it now. And I'm going to fold my washcloth so that it fits into the palm of my hand. So I like to make little apes. I'm going to wet it, wring it, apply 1 drop of soap. That's all we use. If we use too much soap, it actually irritates our skin. The way we clean the vaginal area is by wiping the outer labia going down, and then the labia closest to you down, and then you wash the center. So watch me. Outer, change, outer, change, and then the center. If this was a human, we keep wiping until there was no more residue, but this is a mannequin, so she is now clean. For the state of Florida exam, if I didn't tell you before, you only put 1 drop of soap on the entire washcloth, so don't overthink, just pass your test. In the real world, also don't put too much soap on a woman's private area, because soap, especially if it's antibacterial, it can cause her to have a yeast infection, because the antibacterial soap will kill the bacteria, allowing the yeast to grow. All right, so now I'm going to repeat the process. This is our rinsing process. Down on the outer labia, down on the labia nearest me, and then down the center. Always wipe down, don't wipe back to front, because if you do, you'll be taking some of the fecal matter and bringing it towards the vaginal area. Please check on your resident. Are you still doing okay? Try to keep towels, the linens, everything away from you. I'm going to wipe down, change, wipe down, change, wipe down the center. I'm going to reuse this towel for her backside. So now the front side of my patient is now clean. Her backside is still dirty. I'm going to try to maintain privacy. I'm just going to pull this gown down a little bit. Don't be so concerned about my gloves. Some of you all focus on the minor. I need for you to be focusing on this skill. If my gloves were obviously contaminated, I would change my gloves, but this is just a test. In no college, in no school, in your testing sites, they're not going to let you waste their supplies. So you're going to keep the same gloves on for the entire procedure. I'm going to move my patient in increments. So I'm going to get her shoulders, bring them towards me, get her hips, bring them towards me, get her legs and bring them also towards me. The leg nearest me, I'm going to cross it over. Ma'am, on the count of 3, I'm going to turn you. 1, 2, and 3. All right, I'm going to ask my patient to hold on to the side rail. Can you hold on for me? Great job. So now, I can remove this diaper. I've cleaned her vaginal area. Now I have to clean her rectum and her buttocks. So I have 2 more washcloths left. I'm going to wet, wring it out, apply how much soap, everybody? If you said 1 drop, you're correct. I like to wipe crack to the back. So repeat after me, crack to the back. If you do it the opposite way, you put poop in the coop, and we don't like that. So 1 wipe, crack to the back. Of course, if this was a human, you keep wiping until there was no more residue. Now I'm going to wipe 1 buttock up, flip the sides on the washcloth, and wipe the other buttock. Miss Lucas, are you still doing okay? I'm almost done. I'm going to rinse you now. I'm going to rinse the same way that I wiped. Crack to the back, buttock flip, laundry basket. I'm going to dry. Don't allow the towel to touch you. Or if this pad was obviously contaminated, don't let it touch the pad either, but I'm going to wipe up, and then I'm going to pat her buttocks dry. And now that I'm done with this, this also goes in the laundry basket. So she's on her side. Her front area is now cleansed. I'm going to remove this pad, put it in the trash. Whenever you're placing your new pad, you roll the pad onto the cotton side. So just like a baby's diaper, the cotton side goes towards the skin. The blue or the plastic side goes towards the bedding. Your pad should start off from one edge of the bed, and when you position it, it should be in line with the upper hip. You don't want the pad too far down or too far up, because your patient could actually urinate on your bedding, and that would cause you to, have more work to do. So now that my pad is pushed halfway through, I'm going to go ahead and place my diaper. Try to figure out the alignment. You will become a pro with this the first time you mess up and you put a diaper on incorrectly and you have a mess everywhere. So I have my pad, I have my diaper semi-situated. It's covering her rectum and her buttocks area. Mrs. Lucas, we're going to bring you back now. Are you still doing okay? I'm going to uncross those legs. It's going to be easier for me to fix the diaper on the side that I am on, so I'm going to start off here. I'm going to secure the fasteners. For classroom purposes, I'm not going to walk around. What I'm going to do instead is just gently turn my patient just a little bit towards me so I can get the other part of the fastener. And I'm going to bring it up. You cannot leave your patients on wrinkles, so you want to make sure that there are no wrinkles between your patient, or beneath your patient, excuse me, that they're in proper alignment. So you see how I'm repositioning her legs, but now her torso is not in alignment. So I'm going to reposition her torso to get her back into the center of the bed. Make sure her gown is neat along the sides. We don't put anything beneath our residents because number one, it causes extra wrinkles, but then number two, if she has another accident in the bed, she can actually get that whole gown wet and then it'll be wrapped beneath her, and so that's not fun. Remember, don't be too concerned about these gloves. This is just a test, everybody. If this was the real world, I would have changed my gloves, but now make sure the side rails are up, lower the frame of your bed. You can't leave it this high. Leave your call bell in your resident's hands. Before I take off my gloves, I would be emptying out my water. I would be making sure my room is nice and tidy. Just to make sure you know how to take off your gloves. The first glove, you pinch from the palm, pull down, and secure. Your second glove, don't touch the outer part, 2 fingers under. Remove your glove. Wash your hands. Again, make sure that your bed's low. The patient has the call bell. Wash your hands. Open the curtain. Make sure you check. Items are cleaned. And you are done with your skill. This is Nurse Eunice with Florida Training Academy. And that was a quick video. See ya!